Hello, and welcome to Facebook Live with Dr. Bree. I'm coming in today to reflect on 9 years in direct primary care. I just cannot believe it. When I think about what it was like starting a direct primary care practice and what motivated me every year when it comes to August, when the anniversary comes, I look back on these video journals that I did in 2016, and I've always been a journaler. So it helps me to express myself and say what I'm going through, even if I'm the only one listening. But in that time, I had two little kids. Fiona was 4, Zach was 2, and I was starting a practice, but also finishing, keeping up with my 65-hour-a-week job that was supposed to be 40 hours. And I didn't have time to always sit and write in a journal. So I would talk to myself on video in my phone. And I look back on these videos. One I'll share in the next couple of weeks here on our social media, maybe a couple. Maybe eventually we'll sew them all together in a little clip or show for you all so you can see the ups and downs of what that process was like. But when I reflected on it this year, I'm reminded of the juggle that it was then. Felt like this churn in the traditional practice and the insurance-based practice. I came out of residency so excited. I've had a resident and a medical student with me this month, and it reminds me of how excited you are for your first job. And I was, a new mom, and we started this practice for Health One, and so I thought this can be great. They're going to have all the business stuff. They'll get all that under wraps, and we're just going to do the fun things like taking care of patients. And it was fun, but it was hard. And I remember sitting on, nights where I'd have a stack of phone messages or a stack of things that I didn't get to throughout the day. And my colleague and I would say we were opening our after hours clinic at 5. And there were many times that I was in the office until like 8 o'clock at night and just kind of slugging through the many, many, many demands of a practice that you see 20 people a day and give them your 7 minutes in the sun or as long as you possibly can, and then come out and then the next day their labs come back, but you're still seeing 20 people, and so you may or may not have time to get those labs back to folks and to explain them and to answer questions. And so then the phone call comes in and it says, oh, well, what's up with this lab being abnormal? And of course you want to call and explain it. So then you're there in your after hours clinic until 8 o'clock at night, when your work day was technically over, right? And your patient care time of whatever 8 hours the corporation thought you could spend on those 20 visits and lunch and eating. And Fiona would come at lunch and breastfeed when she was a baby, and we'd try to sneak away for 10-15 minutes of mom time, or nurse her in the surgical room with all the lights off because she was such an active girl later. And I would be like, Fiona, seriously, you have to eat right now. I got to go back to work. It was busy. It was really busy, and I love practicing medicine. But I remember the moment I was on an airplane after starting my direct primary care practice, and it came out of my mouth. Somebody asked me what I did, and I was like, oh, I love my job. And I just explained with this wholehearted love how I love my job. And I remember thinking, oh, that just came out of me. Like, I love my job again. And direct primary care has really allowed me to get off that hamster wheel, get off that treadmill, and do what I originally wanted to do, which was, take care of people and talk about their health and talk about the bigger problems and the deeper problems and when we get into health with someone, there are multiple things at play. It's like this complicated Venn diagram. Sometimes there's a little bit of this physical problem. Sometimes there's a concern and a fear in the room, and sometimes there's a reaction and that reaction exacerbates the concern and the fear, which might actually make the symptom worse. And untangling that takes more than 7 minutes. We all know that. And as a busy working mom, man, when I get to the doctor, I got a list, and I don't want to worry about paying my wellness visit, freebie visit, but also a copay because I mentioned something that the doctor felt like they wanted to ding me and bill me extra for, which is what I was trained to do. The corporation said, well, if they talk about something else that's outside of the preventative wellness care, then make sure and bill them because you can. And of course you can. But then in this day and age, that bill ends up back in the lap of the patient, 90% of the time. And that doesn't feel fair, right? When you're going for what you think is your covered once a year visit, and if you go outside of these, bounds that are invisible to you as a patient, then you end up with a $200 bill later because you talked about something that was on your list because you were finally at the doctor and you had a moment and you're like, is it concerning or not? So for me, direct primary care has been a joy, and I'm so, so grateful in the moments that it was tumultuous, in the moments that it was exciting, starting my own clinic, making my own logo, making my own business cards, making my own website. Luckily, professionals have taken over most of that. I put on my little t-shirt today that I made on Vistaprint, and I had totally forgotten that I picked the phone number to have DO in the end. And here we are 9 years later, and I, I just tell people our phone number and totally forgot that I picked the number because it had DO in the end. All the little nuances, like picking this little, logo that eventually somebody drew for me. This little person was a necklace of one of my favorite patients. And I loved it. And so I said to my initial, business design guy, like, oh, I want this image in the middle, like the family, being held together with the D for the DO, and then the orange O in there, and then the flowers he added. And here we are, with something that has grown into its own life. And I'm super grateful. So thanks. Thanks for being a part of this journey with me, patients, and thanks for believing in me, and thanks for coming and paying a membership and paying extra and realizing that it's worth it, and recognizing that having a relationship with your provider and having somebody who can pause and listen and take a deeper dive is better than what's out there. I went to 3 visits in the last couple of weeks in the belly of the beast, like I like to say, with other family members, my kids, my mom. And it just feels so impersonal, and it feels like the person's behind a screen just clicking off buttons in Epic, which is the best electronic medical record, of course, that's around. And it just doesn't feel like you're there, and luckily the providers are good providers and they really do try, and that they've got their heart in the right place, but the system doesn't make it easy to express that, and direct primary care does. So I'm really grateful for 9 years, and I couldn't have asked for a better path, and the fact that it's been sustainable and that we've been able to add other providers and expand our reach. I'm so lucky, and I just want to say thank you. So I hope you enjoy the videos of the old school Brie. There were like less wrinkles mostly, and tons of enthusiasm, and sometimes some fear, and sometimes the question mark of whether or not this crazy idea of mine of putting my passion behind the name of direct osteopathic primary care was actually going to work out, and it did. So next year we'll have a big party for the 10-year anniversary, but this year I hope in the next couple of weeks you enjoy a little flashbacks of what it's like to stick your neck out there in direct primary care. And if you're a provider and you're thinking, oh my gosh, I've got to get out of the shackles of this world, then you can. I hope you see that it is possible. There's so many ways that it is possible now to learn how to do it on your own, and how to live on a shoestring for the passion that you have to come back into medicine. And that is possible. Like, you don't have to do it the same way that everybody else is doing it, and you don't have to do it the same way forever. And I hope that more and more doctors recognize that, and patients recognize that when a doctor is charging a membership or converting their practice or making a change or leaving a corporate practice, go out on their own, that you kind of pay attention to that and be like, oh, I wonder why that person's doing that. They're not doing it to make $1 million. They're doing it because they care about their job and they want to do a good job doing their job. And they recognize that the limitations of the system that's out there in the belly of the beast make it hard to do a good job. And they want to do better by you, and they want to do better by the care that they offer. And if more and more of us do it, then we can take those costs out of the belly of the beast, and people can use their insurance for a collision with the healthcare industry, which is what you need it for, right? If you go to the emergency room or you have surgery or you have like a major problem, then you have that insurance there to kind of back you up. But now in 2026, you'll be able to use your HSA to cover your direct primary care monthly membership, and that's FSA, HSA. It's all legal now, so that there's no questions, and the IRS will absolutely not blink an eye at it, which is really nice for people, because then you can feel more confident in making the choice that your primary care, your, what I like to call here at Direct Osteopathic, our preventative, proactive, holistic approach, like that doesn't make a ton of sense to have that in your routine insurance, because we're like your gas and your oil changes in your car. We're not a collision, right? So save your insurance for the collision and use your gas and oil changes in a direct primary care practice where you can be seen as an individual and have a relationship with your provider who knows you. And you can know what that individual recommendation is coming from somebody who has that knowledge of your background. I was telling my student, I was sending a portal message earlier, I'm going to send this person a handout on hormones, pros and cons, but I know that this person's going to worry about their background. They're worried about their family history, which I know really well, so I don't have to look at the chart. I remember this person has a worry around heart disease, so I'm going to speak directly to this person's worry that I think that this hormone is safe in the setting of heart disease because of X, Y, and Z on their history. But it takes me 2 seconds because our patient panel is small enough to hold in my hand and in my heart. So thanks. Happy 9 years.